Nicola Hill joins us now from London. Nicola, it's very shocking to see this. Do we know why men are more at risk?
Well, initially they thought it was because in China men smoked. About 62% of the men in Wuhan were smokers, only 3% of women. But as the virus has spread across the world, they've realised that there must be something else. So one theory, a study published in the European Heart Journal this week, showed that men have more of an enzyme called ACE2 in their bloodstream, and they believe this can come from the heart to the lungs. And this enzyme, it's believed, is a way which the virus uses to get into cells and replicate. Now, there's caution about this study because the people involved all had heart failure, both men and women. But it has shown that apparently very vital drugs called ACE inhibitors and ARBs, which people with heart failure, kidney disease and diabetes use, it's shown that that doesn't give people more of a chance of getting COVID-19, which is very important. Now, another theory is perhaps it's chromosomes. So women have two X chromosomes, men have an X and a Y. And the X chromosomes have thousands of genes in them, and some of them have implications with immunity. So the fact that women have many more of these genes might be one of the reasons why our immune system is stronger. And another reason is to do with the hormones, estrogen and progesterone, which women have and men don't. And they think that has another part in helping women have a stronger immune system. Now, the downside of that for many women is that we're more vulnerable to immune diseases such as muscular sclerosis. But they think that those things together might have some reason why women are doing so much better than men, not in getting the disease, the numbers are the same, but certainly in having it more seriously and dying from the disease.
It's very concerning indeed. Nicola, so the question, what can be done?
Well, bizarrely, one of the things that is being done, Maria, is that there's a study in New York where they're giving men estrogen patches. These are the hormone replacement therapy that many women are given after the menopause when they're no longer make hormones. So this study is giving men and older women a week's supply of the patches. Now, what they're measuring is what dose to give because they don't want to make them men have too many people. But that's one of the things they're looking at. Another study that's been launched here in the UK by the government and the England Genomic Project is mapping the DNA of 20,000 COVID-19 patients, and they're going to compare that to 15,000 people who don't have COVID-19. And they're going to look there to see if there's another genetic difference between not only men and women, but also some of the supposedly healthy younger people who seem to have very serious infections of COVID-19. So that in itself hopefully might give us more of a reason why it is that particularly men are so much more vulnerable. And it's like you said, the figures are quite dramatic, the difference between men and women.
Absolutely, very dramatic and very concerning. Nicola, thank you so much for the update. Nicola Hill, our health correspondent from London.